So now we are going to explain about blood supply of upper line. It's my important topic, but I am not explaining everything about blood supply. The main what is important, okay? Okay, you know the blood is supplied by which organ? The heart, right? So from arc of aorta, that is a arc. This arc of aorta is present in a thoracic fourth, okay? Thoracic fourth. So there will be question in MCQ, okay? This arc of aorta, okay? This arc of aorta, they are having division in both left and right side, okay? In right side, they will form brachiocephalic artery. Brachiocephalic artery. This brachiocephalic artery will be divided into two. That is, it will form right common carotid artery and right subclavian artery, okay? And the left side to form directly the left common carotid and the left subclavian artery. Okay. About carotid artery, we will study while dealing with our head and neck. Okay. Supply passes through here neck side and it will go to the head in the brain region. So at the time of studying that one, we'll deal with that. Okay. Now our branch is our subclavian artery branch. Okay. So we'll start from the subclavian artery. Subclavian artery is having three parts. Okay. Subclavian artery is having three parts. First, second, and third. Okay. Now to remember the subclavian artery branches, there is a mnemonics. Okay. You can remember like vitamin CD. Okay. Vitamin CD. So V for vertebral artery. I for internal thoracic artery or internal mammary artery, okay, which supply our mammary glands, okay. Okay. Now we have to divide the first, second and third part. This vertebral artery, internal thoracic artery, and we have thyrocervical trunk here, thyrocervical trunk, okay. This thyrocervical trunk can be right thyrocervical and left, okay. It can be right and left. So as there is three parts, the right and left thyrocervical trunk, till here it is the first part, okay. Till here it is the first part of subclavian artery, okay. I told you it is having different parts, okay. So till here it is the first part. Now we will deal with the second part. Second part we have C for costocervical trunk, okay, costocervical trunk, and D for dorsal scapular artery. D is for dorsal scapular artery. Here the right costocervical trunk, it is in the second part, okay. The costocervical trunk is in the second part of subclavian artery branches, and the third part we have dorsoscapular artery. So it is having first part, second part and third part, okay. So how to remember vitamin CD? So we have first part here, second part here and third part here. So from arc of aorta it originates, then subclavian artery is having vitamin CD branches. So after subclavian artery, what we are having is, we are having, see, I have tried something here. Costocervical trunk, it is also right and left. Okay, it is also left and right. This left costocervical trunk is a part of first branch. Left costocervical trunk is a part of first part of subclavian artery, and second part only contains the right part. Okay, so keep in mind. At least you have to remember vitamin C, this CD. These are the branches of subclavian artery. The third dorsal scapular artery is the third part. Okay. So after subclavian artery, we will have axillary artery. Next main branch is axillary artery. This axillary artery is also having three branches. First part, second part, and third part. While studying the surgical neck of humerus, we have mentioned some branches are the part of third part of axillary artery. What were they? They are the anterior circumflex humeral artery, anterior circumflex humeral artery. At the same time, posterior circumflex humeral artery, and the subscapular artery. Subscapular means supplies scapula, subscapular artery. See here, the important point is, it is the biggest branch. Okay, subscapular artery is the largest branch. Okay, so subscapular artery is the largest branch. First and second part is not that important. So third part contains anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. So start from subclavian artery, it is vitamin CD, these arteries, then it goes to the axillary artery. So after axillary artery, we will form the brachial artery. See, this axillary artery forming, where is a location? It is a location where the clavicle, where the first rib is attaching to the clavicle, right? First rib attaching to the clavicle. This location is formed, this axillary artery. The location where first rib attached to the clavicle. Okay, so you know the subclavian artery and axillary artery. Okay, now the next one, it is the brachial artery. Okay, brachial artery is in the middle of arm. Okay, it is in the lower order of teres major. Okay, so subclavian artery, axillary artery. So it is in the first rib attached to the clavicle. Now I am raising this. Okay, you have written this much, right? Now the next branch they will form is, you can continue, that is the brachial artery. Okay, so from axillary artery it will be coming to the brachial artery. Okay, this brachial artery, where is a location? In the middle of arm. Middle of arm, on the lower side of teres major. Okay, axillary artery at the attachment of first rib with the clavicle. The brachial artery is here. The brachial artery is having an important branch that also we have studied, that is profunda brachii. Okay, that is in the spiral groove of humerus. Profunda brachii. Okay, now this brachial artery, they will be dividing into the radial and ulnar artery at cubital fossa. Okay, they will form ulnar and radial artery. Okay, this division occurs in cubital fossa. Okay, at head of radius. You remember the proximal region of radius, the head is in the proximal region. head of radius. This is the location where it divides in cubital fossa. So this brachial artery will be divided into ulnar artery and radial artery. Ulnar artery mainly supplies the forearm. So which is the main artery supplying forearm is ulnar, and radial artery mainly supplies the arm. Okay. So if MCQ comes, which is the main artery supplying forearm, it is ulnar, and radial artery supply the arm. Okay. So these are the main. Sorry, I wrote here ulnar for forearm and the radial for. This is not arm. This is hand. Radial artery supplies the hand. Okay. The hand surface. Okay. Forearm means here. Okay. So ulnar supplies forearm and radial supplies hand. Clear till here? So it starts from the arc of aorta, then subclavian artery, their branches, axillary artery, their branches, then brachial artery. Brachial artery divide from from the lower trail of teres major. Then brachial artery will be dividing into the ulnar and radial at cubital fossa at the head of radius. Okay. Now some important points regarding radial and ulnar artery. Okay. This radial artery will form principus indicis. Okay. Radial artery in the hand, they will form principus indicis. What is the index finger? Our index finger is this one. Okay. So radial artery, they form princeps indicis. Okay. Then they will form radialis indicis. Okay. They will form princeps indicis and radialis indicis. Then radial artery and ulnar artery, they together form the palmar arc. Radial artery plus ulnar artery